Okay, take 5 seconds to pause the video, read the question, and then we'll go through the answer. All right, so a shorter question, but a lot of these arrow pushing mechanisms are actually some of the hardest problems for most people on step 1. So let's talk about how we would attack this question here. So we have a 68-year-old female, past medical history of osteoarthritis, hyperthyroidism, coming to the emergency department with shortness of breath. States that she has been having palpitations for the past 2 hours, reports running out of her thyroid medication 5 weeks prior, and has not yet refilled her prescription. She is later diagnosed with new onset atrial fibrillation with rapid ventricular response. She's initiated on metoprolol for rate control. Which of the following primary changes in chemical mediators will likely occur due to the initiation of this medication? So, we're talking about metoprolol, and so we just talked about this. So metoprolol primarily is going to affect which receptor? It's going to be beta-1 blocker, right? It's a selective beta-1 blocker. Now remember, we're looking specifically at the RAAS system here. So how does beta-1 affect the RAAS system? Normally beta-1 would stimulate the juxtaglomerular cells to release renin, right? And then renin would be responsible for converting angiotensinogen into angiotensin 1, which would then get converted to angiotensin 2 by ACE, which would then eventually lead to aldosterone release. So this is all you really need to answer this question here. Okay, so let's see what would happen if I use metoprolol. If I block the beta-1 binding to the juxtaglomerular cells, if I block that, right, what's going to happen? Well, all of these downstream should actually drop, right? Because I'm blocking the pathway way up here, right? So everything downstream should actually be low, and that's why E is the right answer, okay? So what would be a situation where A would be the right answer, where all of these would actually be high? If all of these were to be high, I'd have to block something way down. Let me erase some of this. If all of these were to be high, I'd have to block maybe down here at aldosterone. Maybe I have to block aldosterone's binding to its receptor, okay? If I blocked that using a drug, let's say like spironolactone or a eplerenone, right? If I use either one of those, these are mineralocorticoid agonists. These are potassium-sparing diuretics, which we'll talk about a lot more in the heart failure and renal section. But yeah, if I use spironolactone, I'm going to block the pathway way downstream, and so everything proximal will be elevated. So that would be a great option A here. Okay, if I said I gave the patient spironolactone. How about B? Well, B would just be one step up. So B, we have aldosterone low, but everything else is high. So that would be if I block the pathway, say there. This would be very classic for an angiotensin receptor blocker like losartan, right? That's going to block the angiotensin 2 receptor so that I can't get my aldosterone. That means everything else, everything proximal, will be elevated. So that would be very classic for B. How about C? So C, right? In C, my angiotensin 2 and aldosterone is low, which means that maybe I'm blocking the ACE enzyme. Why don't I use an ACE inhibitor here? If I put an ACE inhibitor here, that shuts this down. These would both be elevated, right? Because I can't do anything with them. I can't get past this ACE enzyme, and for that reason, I'm not able to form angiotensin 2 or aldosterone. So that would be a great option for C. How about D? So D says that angiotensin 1, 2, and aldosterone are low, but renin is up. So the same concept. If I blocked somewhere here, or if I altered the activity of this renin, for example, then what would happen is I'd get a decrease in angiotensin 1 because I can't form it, right? I get a decrease in angiotensin 2 and aldosterone, and my renin would build up. This is very classic for a direct renin inhibitor, like we talked about. Direct renin inhibitors, remember, they alter the activity of the renin, but they don't decrease the concentration of the renin. They just make it so it's kind of inactive in a sense. Okay, so you're going to have high levels of renin and decreased levels of these mediators distal or down in the pathway. And so D would be classic for a direct renin inhibitor. But in this situation, E is the right answer because we're blocking the pathway very proximal up here at the juxtaglomerular apparatus. And for those reasons, as mentioned, E would be the correct answer.